As I faced my tiny, frail 70-year-old mother, clutched both of her shoulders in my hands, I choked out the hardest words I had ever spoken in my life. Mom, you know this may be the last night Dad ever has at home. She bravely answered, I know. My father's behavior from his Alzheimer's disease had become too hard for my mother to manage any longer. She was not able to sleep. She was down to 100 pounds. The next day, we drove Dad to Hastings Hospital for a psychological examination. From there, Dad spent the last 7 months of his life in a secure unit in a long-term care facility, and indeed, he never did come home again. Today, my goal is to explore the world of Alzheimer's disease with you. I will describe the incidence, possible causes, the symptoms. We will discover how families and how patients handle the disease. And with the prevalence increasing, we will understand why finding a cure is just so vital. The National Institute on Aging describes Alzheimer's disease as an irreversible, progressive brain disorder that slowly destroys memory and thinking skills, and eventually even the ability to carry out the most simple tasks. It is fatal, but oftentimes before succumbing to the disease, a person will die of its complications. It's the most common form of dementia, accounting for 70% of all of the dementia cases. As many as 5 million Americans suffer from Alzheimer's disease, according to the Centers for Disease Control and Prevention. 37,000 Nebraska residents have the disease. Although incidence of early onset, that means that people who get the disease before the age of 60 is increasing, the disease usually begins after the age of 60, and the risk goes up with age. Between 65 and 70-year-olds, Alzheimer's disease is about 5% of the men and women, but by age 85, it accounts for half of the population. The CDC reminds us that although this incidence is high, Alzheimer's disease is not a normal part of aging. It is important to note the incidence is rising. The number has doubled since 1980 and is expected to be as high as 13.5 million by 2050. Alzheimer's is the 6th leading cause of death in the country, and it's the only cause of death among the top 10 in the United States that cannot be prevented, cured, or even slowed down, according to the 2011 Alzheimer's Disease Fact and Figures report. 2000 to 2008 mortality data cites death rates due to stroke, prostate cancer, breast cancer, heart disease, and HIV are all decreasing. But in that same period of time, Alzheimer's disease has increased by 66%. The reason the death rate from this disease is so high is scientists have not found a cause. The disease was named after its founder, and according to the National Disease Fact Sheet from the National Institute on Aging, in 1906, Dr. Alois Alzheimer examined the brain of a deceased woman who was known to have unusual mental illness involving memory loss, language problems, odd behaviors. The doctor's examination found abnormalities called amyloid plaques and tangled bundles of fibers in the brain. Along with the loss of connections between nerve cells, plaques and tangles are the main feature of the disease. So what causes plaques and tangles to form? Well, scientists don't know. But according to the National Institute on Aging, likely causes might be linked to genetics, to lifestyle, maybe to environmental issues. Diagnosis can only be determined conclusively with the examination of the brain tissue after death. But there are several methods to diagnose possible Alzheimer's disease. Medical history, cognitive testing, carrying out tests to rule out other medical conditions are all used by doctors to diagnose Alzheimer's. When my father was suffering from Alzheimer's disease, I often said, if only it just involved forgetting, not remembering, it would be so much easier for families to handle. In addition to memory loss, symptoms involve sleeplessness, agitation, wandering, anxiety, anger, depression. Victims experience hallucinations, delusions, and paranoia. The Alzheimer's organization states drug therapy can be used to manage behaviors as well as maybe slow down the disease, but unfortunately, no drug can stop the disease's progression for longer than a few months or a few years. In the end, the body shuts down when the brain can no longer tell the organs to function. All fatal diseases are hard on families, but Alzheimer's takes an especially hard toll on family members who are caring for their loved ones who are suffering from the disease. Imagine caring for your spouse or your elderly parent who must be watched 24/7 or they'll wander away and get lost. You must help them dress, bathe, eat, go to the bathroom. The person that you always depended on is now totally dependent on you. And you know, they don't even have a clue as to who you are. The person you knew is dead. Families in the caregiving role deserve and need appreciation, compassion, and mostly support. Caregivers need education about the disease, how to manage behaviors. They need information about financial resources and how to handle legal issues. The most important is the support. In order for caregivers to be able to care for their family members, they need to first take care of themselves. Handling the high level of stress that is a result of caring for someone with Alzheimer's requires very frequent breaks for that caregiver. That's called respite. They need to have informal support from family and friends who will listen and care. And they need to seek out a formal support group that from people and learn from people how to cope with the disease from other support members who are also in the same situation they are. In conclusion, let's talk about the future as society deals with this disease. I mentioned earlier, incidence is increasing. This is partly due to the huge number of baby boomers who are coming into their elderly years. An increase in numbers diagnosed points to an increased urgency to stop this deadly disease. The National Institute on Aging reports important advances have been made in the knowledge of brain function. In a very, very recent article by Julie Steenhuisen from the June 22nd edition of Medline Plus, she described a test that can determine who will progress to full-blown dementia by analyzing spinal fluid. Researchers are confident an early identification can lead to early treatment or even disease prevention. I've described the disease, its incidence, possible causes, and symptoms. We've talked about treatment and how the disease affects the family caregivers who suffer from it and their family members. Now you might be asking yourself, how can I help? Here's what you can do. Support a family caregiver by taking care of their loved one for a little while they get away for a break. Listen to their frustrations and make a donation for research. Let's eradicate this killer disease. Once is enough to mourn the death of a family member. No one deserves to see their loved one die twice.